Being recognized with the Satcher Award is both a tremendous honor and I think a personal challenge for me to continue to strive to reach the standards set by Dr. Satcher. I still feel like I'm very much at the early stages of my career and really an infant in the work to improve community health and reduce health inequities. But I'm beginning to understand that a hallmark of this important work is this ever-growing sense that because there's so much work to be done, there's so much more that we collectively can do and should contribute. I love building a career at the University of Rochester and working with colleagues and mentors like Dr. Ann Falsey and Dr. Edward Walsh, as well as our amazing team at the Infectious Diseases Research Clinic. We've done really good work to define the burden of respiratory diseases like flu and RSV and COVID-19, and to find ways of improving the care of patients with these infections and to develop vaccines to ultimately prevent disease. But I think what I've learned this last year is that equally as important as that, as building a career, is finding a way to really be planted and deeply rooted in your community. Before the pandemic found its way to Rochester in March of last year, we had 2 months to prepare for how it would impact our community. I don't think we realized that how it would disproportionately affect communities of color and those with fewer resources, but we really should have, because it's not just true of COVID-19, it's true for most diseases. A fundamental truth of health inequity is that it does not just represent inequity in access to healthcare, but also inequity in the promise of good health. That's what makes health inequity both unjust and inhumane. There are a lot of reasons for this, including some of the systemic issues we've talked about today related to access, but there are also social determinants like literacy. Knowledge is a big one, and distrust that has resulted from historical abuses. This is really true when it comes to research, where the focus of that distrust surrounds this idea that risk has disproportionately burdened communities of color, and it's true. But there's a lack of understanding of how that same distrust may prevent these same communities from benefiting from research. We switched focus in the late spring to working on clinical trials of COVID vaccines. We knew we had a problem. How would we overcome decades of distrust in medical research in just a few months to be able to recruit a diverse population of study participants and prove that these vaccines were effective and safe in everyone? We were also thinking ahead to building the trust that will be needed to ensure the success of the vaccination campaign that will be required to end the pandemic. And always in the back of our minds is this idea that equity means making sure that everyone has the same access to the benefits of participating in research, because there are benefits. In the middle of a deadly pandemic, one of those benefits might be having early access to vaccines through a trial that we were starting to believe might actually be very protective. I don't pretend to be an expert on community engagement or a leader in the efforts to eliminate health inequities. But I know the people who are those things, people like Jackie Dozier and Phyllis Jackson at Common Ground Health, and Sister Marcia Allen at the Vineyard Farm and Outdoor Center for Excellence. I've learned a lot from them this year and from other community leaders who've partnered with us in our research efforts and helped us to be part of engaging our community to prevent disease. In an extraordinarily challenging and sometimes frankly devastating year, I hope there's been a mobilization and a formation of partnerships that will be the foundation for the future of community health initiatives here in Rochester. I've always felt privileged to be able to do good and meaningful work as a physician and as a scientist. But as Dr. Bennett says, vaccines don't save lives, vaccinations do. And it's the same thing with good and meaningful work. It's really much less impactful unless knowledge is shared and access to resources is equitable. I've seen firsthand how the right messenger, bringing a truthful message about healthcare and a commitment to back that up with resources, can reverse some of the distrust which contributes to health inequity. We need more messengers of color and more partnerships with those who have years of experience doing this work. And I now know that every research study and every research team needs to be intentional in promoting diversity and inclusion for the benefit of all communities. that's where I hope to continue to contribute. I'm very thankful to have found a place in these efforts as someone who is supported by trusted community partners and who can share knowledge which I hope educates and empowers people to make reasonable decisions that lead to good health. Thank you.